Hurricane Melissa struck Jamaica in late October, and almost immediately, the world showed up. Within 48 hours, a US-based Christian humanitarian organization, Samaritan's Purse, airlifted disaster response teams, mobile medical units, water systems, and emergency supplies into the island. By November 5th, they were running a full emergency field hospital in Black River, surgeries, inpatient care, life-saving treatment. Soon after came reinforcements. Spanish emergency medical teams from Europe operating field hospitals, the Barbados Defense Force providing regional military medical support, Pan-American Health Organization coordinating regional public health response, UK emergency medical specialists opening clinics by mid-November, and by early December, a Chinese hospital ship, a floating surgical complex, docked offshore performing hundreds of operations. So let's correct the record right now. Jamaica was not abandoned. Help arrived fast. Help arrived generously. Help arrived globally. The problem isn't who came. The problem is why Jamaica still needed them weeks later. Because when operating theaters live in tents, when ward space depends on foreign uniforms, and when outpatient services disappear as ships sail away, that's not resilience. That's a system being propped up. And while the government says it was prepared, it also admits its own structures were never designed to handle a disaster of this scale. How in 2025 that this is the same song being sung? When Jamaica has been hit by 58 hurricanes between the 1700s and 2025, noting a worrying increase between 2000 and 2025, where Jamaica has had 15 hurricanes, prepared only on paper, exposed gravely in practice. The country is still standing on borrowed hospitals, borrowed doctors, and borrowed time. Was Jamaica truly prepared? Or did we confuse planning with resilience? Let us look into the hard truth that no press conference can spin. Foreign medical teams were never the failure. They were the buffer. The failure is what wasn't done while that buffer existed, because reinforcement buys time, and time is supposed to be used to build capacity, not dependence. With multiple foreign teams on the ground, Jamaica should have immediately moved to establish a permanent national emergency hospital, not another tent, not another borrowed unit, but a hardened, locally staffed emergency facility. That facility should have operating theaters, oxygen generation, backup power, water purification, modular wards, and Jamaican staff trained alongside international teams. Instead, we got transition plans, but no fixed national emergency backbone.